Hello, this is WASSCE Tutoring by Terence P, and this is part 2 to a series of videos that I'm doing on solving simple WASSCE genetics problem from the 2016 WASSCE paper. In part 1 of this series of videos, I solved question 42, and today I'm going to solve question 43. Question 43 reads, a sick baby was successfully transfused with blood from the father, who has blood group AB. What is the blood group of the sick baby? This question is asking you to state the blood group of the sick baby, knowing that the baby received blood from its father, who has blood group AB. In order for us to answer this question, we have to construct what I refer to as a compatibility test table. From the compatibility test table, we can be able to easily answer such a question. In part 1 of this video, I talk about blood type, and in one of my previous videos, I talk about the compatibility test table. However, I'm going to construct the compatibility test video here with specific reference on transfusion of AB blood group. I'm putting in the blood groups in a table: AB, AB, and O. My focus now will be on the AB blood group recipient donor relationship, beginning with the transfusion between AB and E. That is, a donor has AB blood group and a recipient has A blood group. Can a donor with AB blood group give blood to a recipient with blood group? This is not compatible. Why is this not compatible? This is not compatible because in the blood of somebody who has A blood group, they have a plasma containing antibody anti-B. And that antibody anti-B is capable of reacting with the B antigen, and that will cause agglutination, thereby making such a transfusion not compatible. The next is a donor of AB blood giving blood to a recipient of B blood. This is also not possible because a person who has blood group B has anti-A in their plasma, and there is antigen A on a red blood cell of AB group. Once you have an antigen A and antibody anti-A, there will be agglutination. This is also not possible. Can a person with blood group AB give blood to a person with blood group AB? This is possible. Why is this possible? This is possible because on a plasma or in a plasma of somebody who has blood group AB, there is no antibodies. Therefore, there will be no agglutination. And lastly, can a person with AB blood group give blood to a person who has O blood group? This is not possible because in a plasma, there is both anti-A and anti-B antibodies that will cause agglutination once reacting with the antigen A and B on a plasma membrane of a person, on a plasma membrane red blood cell of a person who has blood type AB. With this being said, looking at our compatibility table, the only compatible result we have is a donor of AB blood group giving blood to a recipient of AB blood group, as in here. Our answer to this question is simply C, on grounds that a person with AB blood group can only give blood to a person with AB blood group. Since the father has AB blood group, therefore, to ensure that his transfusion is successful, the sick baby should have also AB blood group. So question 43, the answer here is AB. Now I'm moving on to question 44 and question 45, and I'm going to read what is asked of us. The illustration below represents a cross between a color-blind male and a normal female. Study it carefully and answer questions 44 and 45. This is a cross, like the question said, between a color-blind male. This is the genotype of a color-blind male, and this is the genotype of a normal female. The genotype of a normal male is XY. This you should remember. The genotype, I repeat, of a normal male is XY. At this point, I would like to talk a little bit about color blindness. Color blindness is a genetic defect wherein a person having such a disease won't be able to see certain colors. It's actually hereditary. That is, parents are able to pass on this defect to their children, and children are able to pass on the defect also to their children. However, this genetic defect, in order for it to affect a male, the defect should be on one of the chromosomes of the male, one of the sex chromosomes of the male, and that is the X chromosome. Once the defect is on the X chromosome, the man becomes entirely affected by color blindness. However, for this disease to affect a female, this disease should affect two of the sex chromosomes of that female. That is, there should be XC and XC. This will illustrate what we refer to as an affected female. In this cross, the two parents produce 4 offspring, and these here are the offspring. The offspring here are 2 females and 2 males. Like I mentioned, this is the genotype of an affected female. Therefore, these females here cannot be affected. And once they cannot be affected, but then they have a defect in one of the chromosomes, we refer to them, or they are referred to as carriers of a particular genetic disorders. They are carrier on grounds that they have the defect, but then the defect cannot affect them. However, they are capable of passing on the defect to their children. I'm going to read question 44. Question 44 reads, what is the genotypic ratio of carrier females to male in the cross? I'm undoing the annotations on the screen, on the slide, sorry. How many males are in this particular cross? How many females are in the particular cross? There are two females and there are 2 males. Genotypic ratio is a ratio, that is a 1-to-1 relationship or 2-to-2 relationship, 3-to-3 relationship, specifically looking at the genotype of the individuals concerned. So the genotypic ratio of this particular cross is 2-to-2. However, in our option, there is no 2-to-2. Ratio can also be expressed as fraction. Expressing this ratio as fraction will have 2/2, and reducing this fraction, we have 1/1, thereby making our new ratio to be 1-to-1. Do we have 1-to-1 here? Yes, we have 1-to-1. Definitely, our answer to this question is A, which is the genotypic ratio of 1-to-1. Question 45 reads, which of the genotypes are carriers of color blindness? Like I mentioned, carriers are individuals who have a defect. However, they cannot pass the defect on. Carriers, I'll repeat, carriers are individuals who have the defects. The defect is not affecting them. However, they are capable of passing on the defect to their offspring. Let me undo this. I previously mentioned that the individuals here, these 2 females, are carrier. Which of the genotypes are carrier of color blindness? So definitely is our correct answer. And individuals, Roman numeral 1, and individual, Roman numeral 2 only, are carrier of color blindness. With this in mind, I have completed what I have to teach in this particular video. In part 3 of a series of this video that I'm doing, I will answer question 46 and question 47. These are my references. You can make use of reference number 3. It is an online e-learning platform where past questions are posted and then answers are provided. And for questions and suggestions, you can contact me on my numbers or my email address. Thank you for watching, and I encourage our Liberian students to subscribe and like my channel for more videos.